Hello, I am Jezreel Flores Heron from Basic Psychology 3A. I will discuss now the self-reinforcement and self-efficacy. Sa tingin ko ay medyo familiar na kayo sa salitang reinforcement at efficacy. At tatalakayan din natin kung paano ito makakaapekto sa behavior ng isang tao. So, let's start. Self-reinforcement and self-efficacy. According to the social learning theory, two important aspects of the self is self-reinforcement and self-efficacy. So, yung self-reinforcement, pwede rin natin siyang tawaging self-rewarding or self-punishment. Ito yung ibig sabihin na kapag na-meet natin or na-exceed natin or minsan ay nagkamali tayo sa isang expectation or sa isang standards. So, ang example nito ay yung pag-treat mo sa sarili mo dahil nakapasa ka sa exam. Or pwede rin ganito, hindi ka muna maglalaro ng mobile games dahil bumagsak ka sa isang subject. So, yung dalawang yun is yung pwede rin natin silang consider as self-reinforcement or self-punishment. So, next naman natin is yung self-efficacy. Self-efficacy is a sense of sufficiency, efficiency, and expertise in dealing with life. So, ito minsan alam na natin na na-apply natin ito sa sarili natin. So, ito rin ay sumasalamin sa pagkakaroon ng lakas ng loob sa anumang gawain na gagampanin mula sa sariling motibasyon at kakayahan. So, siguro bilang isang estudyante ay nararanasan na natin ito, pero hindi natin alam kung ano talaga ang tawag dito. So, mamaya ay mas may di-discuss man natin kung ano ba talagang ibig sabihin ng self-reinforcement at self-efficacy. We will discuss first the self-reinforcement. This is just as vital as reinforcement from others, especially for older children and adults. We set personal goals for ourselves in terms of conduct and achievement. Halimbawa na lamang kung i-apply natin ang self-reinforcement sa bata, ay mas nagiging active sila sa kanilang pang-sarili at pang-academic na gusto nilang maabot or yung personal and academic endeavors. Mas nagkakaroon sila ng paniniwala na kayang-kaya nila na mag-exert ng effort sa isang bagay at nakakatulong din ito upang matukoy ang mga kahihinatnan or consequences sa mga gagawin nila, kung ito ba ay makakabuti or makakasama. Next naman natin ay ang unrealistic performance standards. So dito naman, ito yung mga people who set unrealistic performance standards. For example, those who witnessed and absorbed behavioral expectations from highly brilliant and successful models, that they may persist in attempting to meet such unrealistic expectations despite repeated failure. Dito naman ay nagkakaroon ng overconfidence or nag-overpower yung confidence ng isang tao kapag sila ay merong unrealistic performance standards. Example na lamang nito ay yung kapag isang mga klase na first honor ay nag-one take lang sa board exam, pero na ikaw na isa sa mga klase niya ay ilang beses nang nag-exam for board ay di pa rin nakakapasa. Pero ito lamang ang example ng unrealistic performance standard ha, hindi lahat ng tao ay may ganitong disposisyon sa buhay. So next na tayo. Self-efficacy or believing you can. Our self-efficacy is determined by how successfully we satisfy our behavioral standards. Self-efficacy relates to sentiments of adequacy, efficiency, and competence in dealing with life according to Bandura. Self-efficacy is increased when we meet and maintain our performance criteria, and when we fail to reach and maintain them, it is reduced. Self-efficacy was also articulated by Bandura in terms of our impression of controlling over our lives. We will now move on to low and high self-efficacy. People with poor or low self-efficacy feel powerless, as if they have no influence over their lives. They believe that every effort they make would be in vain. When they run into difficulties, they give up quickly if their first attempt to solve the problem fails. People with severely poor efficacy will not even try to cope, since they are sure that nothing they do will help. So self-efficacy or low self-efficacy can derail motivation, lower aspirations, impair cognitive capacities, and have a negative impact on physical health. On the other hand, people with high in self-efficacy believe that one can deal effectively with events and situations. They continue in undertaking and frequently perform at high level because they expect to succeed in overcoming hurdles. These people are more confident in their talents and they have little self-doubt than those with low self-efficacy. They regard difficulties as opportunities rather than threats, and they actively seek out new experiences. Source of information in self-efficacy. So narito ang apat na sources of information na ginagamit upang matukoy ang self-efficacy ng isang tao. Performance attainment, vicarious experiences, verbal persuasion, and physiological and emotional arousal. Ang una ay ang performance attainment. Here, performance attainment is the most powerful source of efficacy judgments. Previous successes give us a clear picture of our degree of mastery and skill. Prior accomplishments illustrates our potential and increase our self-efficacy. Failures in the past, especially recurrent values in childhood, reduce self-efficacy. Kapag ikaw ay nagkaroon na ng maraming achievements na nakamit, ay madali na nating sabihin na meron kang efficacy to do work and may potential ka pa to boost your self-efficacy. Pangalawa naman ay ang vicarious experiences. Seeing other people succeed can boost self-efficacy, especially if the people we witness have abilities that are similar to ours. Dito naman kapag nakakakita tayo ng kaparehas na natin na may same disposition sa buhay na successful, dito ay may tendency tayo na makapag-boost ng self-efficacy. Pangatlo ay ang verbal persuasion. Verbal persuasion, which involves simply reminding people that they have the ability to achieve whatever they want to achieve, can enhance self-efficacy. Sa simpleng pag-cheer sa ating mga kakilala at mga kaibigan ay malaking tulong para ma-boost ang kaniyang self-efficacy. At ang pang-apat ay ang physiological and emotional arousal. So sa physiological and emotional arousal is the fourth and final source of knowledge regarding self-efficacy. It is how we define, or it is how terrified or calm do we feel in different circumstances. This type of information is frequently used to assess our ability to cope. So dito naman sa physiological and emotional arousal ay involve ang ating physical being, kung paano ba tayo rumispond sa isang sitwasyon at kung tayo ba ay magfa-fight or mag-flight. So these are the four sources of information in self-efficacy. Okay, ulitin natin. Yung una ay ang performance attainment, pangalawa, vicarious experience, pangatlo, verbal persuasion, at pang-apat, ang physiological and emotional arousal. Ways of increasing self-efficacy. Bandura came to the conclusion that certain circumstances boost self-efficacy. So number one, exposing people to success experiences by arranging reachable goals increases performance attainment. Number two, exposing people to appropriate models who perform successfully enhances vicarious success experiences. Number three, providing verbal persuasion encourages people to believe that they have the ability to perform successfully. And number four, strengthening physiological arousal through proper diet, stress reduction, exercise, increases strength, stamina, and ability to cope. So, in a number of scenarios, Bandura used this factor to boost self-efficacy. He has helped people learn to play musical instruments, communicate more effectively with persons of the opposite gender, master computer skills, quit smoking, and overcome phobias and physical sufferings. So in overall, mas naging encouragement sa mga tao ang paggamit nito para ma-boost ang self-efficacy ng isang tao. It has opened a lot of opportunities to those who are experiencing difficulties in life. We will move on to the developmental stage of self-efficacy. Self-efficacy develops gradually over time. Bandura concluded 4 stages of self-efficacy. These are childhood, adolescence, adulthood, and old age. The first stage of development is childhood. The parents are the focus of these early efficacy building experiences. Boys and girls have different parental actions that contribute to great self-efficacy in their children. Men with high self-efficacy are more likely to have had warm interactions with their fathers as children. Mothers were more demanding than fathers, expecting greater levels of achievement and performance. Women with high self-efficacy, on the other hand, were subjected to pressure from their dads as youngsters to reach high levels of success based on the study of Sneewind in 1995. Siblings of the same gender are also more competitive than siblings of the opposite gender, which is linked to the development of self-efficacy. The second stage is the adolescence. Adolescents must develop new skills and evaluate their own talents. From a developing knowledge of sex to the choice of college and employment, adolescent transitional experiences required in coping with new demands and pressures. Adolescents must develop new skills and evaluate their own talents. The success of this stage, according to Bandura, is largely determined by the level of self-efficacy established during childhood. The third stage is the adulthood. Adulthood was separated into two periods, young adulthood and middle years. Marriage, parenting, and attempting to develop a job is the new experiences for young adults. For these encounters to be successful, you must have a high level of self-efficacy. People with poor self-efficacy will struggle to cope with these situations and will be unable to change. People rethink their employment, families, and social life during their middle years of adulthood, which can be stressful. We must examine our talents and look for new ways to improve our self-efficacy as we face our limitations and reframe our ambitions. And the last stage is the old age. It's challenging to reassess one's self-efficacy as one gets older. Deteriorating mental and physical faculties, retirement from active job, and social seclusion may need a new cycle of self-evaluation. In a self-fulfilling theory, a decrease in self-efficacy can have a negative impact on physical and mental functioning. Reduced sexual activity, for example, can cause their lack of confidence in one's sexual performance. Physical efficacy issues can lead to weariness and the reduction in physical activity. We may not even try to do something we used to enjoy and perform well as we become older if you no longer believe we can do it. So, self-efficacy, according to Bandura, is the single most essential component in deciding success or failure throughout one's life. Dadako na tayo sa behavior modification. Fears and phobias. If modeling is how we learn our behaviors in the first place, it should also be a good approach to relearn or change them. To reduce fears and other extreme emotional reactions, Bandura used modeling approaches. So yung pangalawang study naman ay about sa fear sa snakes. Bandura and his colleagues removed a strong fear of snakes in adults in a classic research of snake phobia. Ito yung study ni na Bandura, Blanchard, and Ritter noong 1969. The participants viewed a clip in which a snake came closer and closer to children, adolescents, and adults. The models were initially shown handling toy snakes, then touching live snakes, and eventually allowing a big snake to slither over their bodies. When the scenes proved too dangerous for the phobic individuals, they were allowed to stop the film. Their phobia of snakes was gradually eliminated. So sa study naman na ito ay pinanood ng mga participants yung video ng mga bata, mga teens at mga matatanda na may kasamang ahas. Then, yung mga model sa video ay pinakita na pinaglalaruan nila ang laruang ahas. Pagkatapos ay sumunod naman na hinawakan ng isang totoong ahas at eventually ay nagawa na nilang ipulupot sa kanilang katawan ng ahas. Nung na-realize nila na delikado ang video na ito sa mga may phobia sa ahas, ay agad nilang itinigil ang panonood. At ang resulta ay nawala na ang phobia ng mga participant sa ahas. What is guided participation? The guided participation technique involves observing a live model and then interacting with it. Subjects watch through an observation window while a live model handles a snake to cure a snake phobia. For example, the participants then enter the room with the model and study the snakes handling up close. Subjects are enticed into touching the snake's center as the model handles the head and tail while wearing gloves. After a while, the subjects are allowed to contact the snake without wearing gloves. And even in the absence of an observable model, modeling has been proved to be effective. So subjects are encouraged to imagine a model dealing with a feared or scary circumstance or situations in covert modeling, or not actually seeing a model. Snake phobias and social inhibitions have both been successfully treated through covert modeling. So these are the advantages of modeling therapy. Number 1, the totality of complex behavior can be viewed. Number 2, the extraneous behaviors can be changed so that subject only sees the behaviors that are important to them. Number 3, the same videos can be used with multiple patients and by multiple therapies at the same time. So dito, less na ang paggawa ng mga model situations dahil pwedeng gamitin ang mga previous recorded videos. And number 4, modeling techniques can also be used to treat groups of patients with the same problem, saving time and money. Magiging budget-friendly at mas may utilize ng maayos ang time sa pag-treat ng mga patients. Naging matagumpay ang modeling therapy sa pag-treat ng phobia, obsessive-compulsive disorders, at sexual dysfunction. The beneficial effects are said to endure for years. Self-efficacy has been studied extensively both during and after behavior modification therapy. Nakita sa findings na nag-increase ang self-efficacy during the treatment. They more capable of dealing with their anxiety. So tapos na tayo sa fears and phobias. Ngayon ay dadako na tayo sa anxiety. Malatakan natin dito kung paano may a-apply ang modeling therapy sa paglesen ng anxiety. We discovered many behaviors can be changed using the modeling approach. And now, we will look at 2 scenarios, medical treatment anxiety and test anxiety. We will discuss first the fear in medical treatment. May mga tao talagang natatakot especially sa mga injections at pagpapahospital, lalong-lalo na ang mga bata at matatanda. Some people are terrified of medical issues to the point where they refuse to seek help. Ang unang study ay about sa mga batang first time na pumunta sa hospital for surgery. So dito, may dalawang groups. Yung una ay yung experimental group, wherein sila ay nanonood ng isang film about hospital experience ng isang bata. While ang isa naman ay ang control group na nanonood ng isang film about sa youngster na may pupuntahang lakad. Ito ay study nila Melamed at Siegel noong 1975. The film about the child in the hospital was an excellent role model. Despite some nervousness at first, he managed the physicians and medical procedures well. Anxiety was reduced by seeing the modeling film. Furthermore, those who have viewed the hospital film exhibited behavioral issues after being admitted to the hospital than those in the control group. Ang pangalawang study naman ay about sa fear in medical treatment. Na-study tungkol sa mga adults na may takot sa pagpapahospital at dental treatment. Adults' fears of hospitalization and dental treatment have both been reduced using similar techniques. In one study, more than 80% of patients originally refused to undertake or quit a medical procedure because it was too stressful for them, based on the study of Allen, Danforth, and Drabman in 1989. So yung mga nakapanood ng video about sa model na nagkikwento kung paano niya na-deal ang kanyang kaba sa ospital, were more likely to complete the treatment with less anxiety and a shorter stay in the hospital. Ngayon, dadako naman na tayo sa test anxiety. Test anxiety is such a concern for some college students that their exam scores may not adequately represent their understanding of the information being assessed. A group of college students was divided into 2 groups based on their personality test scores in a classic research study. Those with high test anxiety and those with low test anxiety based on the study of Saracen in 1975. Ilang mga students ay nakapanood ng video tungkol sa isang model na nakikwento about sa kanyang test anxiety at kung paano niya ito hinarap. Ang iba naman ay nanood ng video with the same model na nag-discuss about sa test anxiety na walang coping techniques. Under a third condition, students watched the film model talking about other college activities. The subjects were then given a list of nonsensical syllables to memorize and their ability to recall them was examined. The respondents with the highest level of anxiety were the most affected by the model that discussed coping techniques, according to the findings. On the recall test, they performed much better than high anxiety patients have been exposed to the other 2 situations. Ethical issues in behavior modification. Although the results of behavior modification are outstanding, some educators, politicians, and even psychologists have criticized the tactics. They claim that behavior modification is used to manipulate and control people against their will. Pero kinundi na ito ni Bandura. Ang pagbabago sa behavior ay hindi mangyayari kung hindi aware ang subject. Sabi pa niya, ang self-awareness at self-regulation ay kinakailangan sa kahit anong therapy to modify or relearn behaviors to be effective. To put it in another way, behavior modification strategies will not work unless the person understands which actions are being reinforced. Aniya, they are not being treated against their will. Furthermore,
clients themselves decide what they want to change. Hindi ito kontrolado ng kahit nino man. People come to the therapist to eliminate specific fears and anxieties that inhibit their ability to function or to cope with daily life. Sabi ni Bandura, ang client-therapist relationship ay isang kontrata between two consenting individuals. Hindi raw ito relationship between a sinister master controller and a spineless puppet. Dagdag pa niya, ito ay para rin sa personal growth ng isang tao. Removing the constraints through behavior modification techniques can increase our feelings of freedom and opportunity for personal growth.